Hey gang, it's Dr. Kevin Jenkins from Advanced Spinal Care and Rehabilitation in Cambridge, Ohio, the physical medicine clinic of choice for the Southeast Ohio area. I'm excited to come to you today. Today our topic is herniated discs in the spine. Um, every other week we'll have a topic that we've got information on our website about, so we want a little bit more detail about our approach, what makes us different, what makes us unique, and what makes us fantastic, and why people are coming and bringing all their friends to us so that we can help get them better. And then at various times through this, you'll see the crawl. This is fancy high-tech stuff so that you make sure and get our information. It's got our phone number, our website, and our name, obviously. And again, I'm Dr. Kevin Jenkins. And we're in on the internet, phone book, Facebook, Yahoo, all that other stuff. Anyway, herniated spinal disc. With that, what has happened is the outer part of the disc, which is made up of various fibrous layers, have weakened to the point where the middle part has started to push out. And with that, we start having excruciating pain as the disc starts to rub up on the spinal nerves. We can have the typical sciatic or the radicular pain. They're the zingers down your arm. It can cause hand weakness, numbness, and the same with our feet and legs. The pain can be anywhere from mild to severe. Our approach with it is always a very holistic, whole person, everybody's different approach, meaning everybody's not going to be treated the exact same way. So initially you'd come in, you'd visit with me, I'd do an exam, then you'd see our medical staff, Danielle Holt, who's back from medical leave. We're excited to have her back. We appreciate Mary Anderson for filling in while she was having the baby. She did a fantastic job as well. You'd visit with Danielle. She's got, with her medical approach, and again, that's what makes this a physical medicine facility, bringing everything together to make it as well-rounded and tailored to the individual as possible. Then also we would most likely have you visit with Teresa, our physical therapist, and she'd do an evaluation on you too if we felt it was warranted. With that, we approach it with chiropractic, we approach it with medical, with trigger points, joint injections. And then we've got decompression, which is a fantastic modality to help alleviate these problems, because with the decompression is slowly pulling that disc apart and helping to get those fibers to start laying back at more of a 45-degree angle as opposed to the other situation. And the interesting thing with the herniated disc, it can be anything from a severe injury like a whiplash. Those are typically the ways that we'll see those kind of a frank or an abrupt herniation. Just something that just over time has worn you down, and you bend over to pick up a piece of paper and all of a sudden your back is locked up, you can't move, and you've got pain clear down your legs. With that, with our evaluation, if we felt we needed to, we'd order an MRI, or we could do a nerve conduction study, electromyograph study, to see exactly which nerves are being affected, so that we could, again, bring all of the tools that we have at our disposal to use on you. And with those kind of situations, those injuries, your body will have developed incorrect patterns of movement. Those are things that we need to help train out of your body. That's what the adjustments are going to do, as far as putting the vertebra back where they need to be, getting the vertebrae to start moving independently so we don't have locked up situations. And then stretching and strengthening, the SAS approach, stretch, align, strengthen, is very, very key with these kind of situations, so that we can get you feeling better as quickly as possible. And then with one of the questions I was asked this week was, why do some people respond more quickly to chiropractic than others? Part of it's just, what have you done to your body over the years? Wear and tear has a long-term wear and tear definitely has an impact on just how you're going to respond. And the other thing is, what kind of shape are you in? Have you been athletic? Have you kept your weight down? If you're overweight, we've got a constant battle with that, because that extra weight is only wearing down on your spine. So, and that's another thing that we do here, is we do weight loss programs to help you lose that weight, get it off, feel better, Heaven knows I've had to lose some weight, and wedding pictures from last year, a little bit embarrassing. Sorry, Taylor and Kyle. But I lost the weight I needed to because my back got hurt. And through that, I went through these processes that I have patients do. And sometimes it's a good reminder. That's what makes chiropractic unique, is we typically have had done on us what we do to other people, meaning I get adjusted regularly. I've had the trigger point injections. I've had the joint injections. I've done physical therapy. I do decompression regularly. And I do my own home health stretch program that I have learned for what I need to do. And again, everybody's program is just a little bit different. But getting back to that, weight has a factor, age has a factor, prior wear and tear has a factor. So everybody has a different need, and we need to put together a different program for them. Then what do you do every day? Do you sit at a desk? So we've got a more sedentary situation where we've got muscles that aren't firing all day long like they need to. Even somebody that works out but still has to sit at a desk for 8 hours, their muscles are not firing as frequently and as often as they need to. So they're going to need a different kind of care. Then if you've got somebody who is in good shape but has a job that just beats the bananas out of them, that's another situation where they're going to maybe need a little bit more frequent care. My sweet spot right now is 4 weeks. I get adjusted every 4 weeks by one of my buddies, and I have found that that's become critical. I can almost tell when it's getting close to time I'll start having different issues. If I got hurt or needed something a little bit more frequently, I would do what I needed to do to see somebody. Because I believe in what I do, and I do what I believe. Other questions that I had. Okay, this is a good one. This comes in with the herniated disc situation, because I've had people come in and say, gee, once you've started seeing the chiropractor, it seems like you always need to see the chiropractor. Well, we get our tires rotated regularly. We get our oil changed regularly. Why? Because that helps us prevent long-term bad wear and tear on our vehicle. Well, I think our bodies are a little bit more important than our cars, so we need to do those things to keep ourselves aligned and maintain. And the other thing is in patients throughout the 20 years of practice, I've had say, I just feel better. I'm more healthy when I'm getting adjusted regularly. I had patients back in Vegas that would send their kids in to get adjusted right before finals to make sure that they had everything taken care of so that their spines were aligned and they're ready to go so that they could give their very, very best for their exams. You're more healthy. You're better able to do what you need to do. So yeah, it is a lifelong commitment. We make sure that we try and eat healthy our entire lives. We don't necessarily always do that, but we need to make sure that we're maintaining our spinal alignment so that we are healthy. We are able to move better. We can do those things that we need to do and enjoy life because we've got one less thing to worry about. Let's see, what was the other question? Oh, the popping of our own necks, doing that kind of stuff. No, 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 no. The reason being is when you're doing like this and like that, you're not able to get the right force direction that needs to happen, that the chiropractor, like myself, or if you're seeing somebody in your region, if you're in this area, you better be seeing me. But able to generate the right force through whichever region needs to be adjusted. And the other thing is, a lot of time with the cervical spine, I actually prefer the non-manipulative therapies, the activator, atlas, orthogonal, those kind of things, because that gets the correction made much more precisely, and those areas are very critical. Hold on, fancy scroll coming across again. I am high tech, let me tell you what. And if anybody's doing a drinking game for every time I can make a funny face, lucky. Again, Dr. Kevin Jenkins at Advanced Spinal Care and Rehabilitation. Tell your friends, come on in. And as always, please don't ever hesitate to ask me questions. If I don't know the answer, I'll find somebody who does. We're here in Cambridge, Ohio. We've got the best staff in America. We've got the best group of people in America. We're happy. We get people better. We want to help you and your family. You guys take care, and I'll see you next week.